Hey guys, Ibreez here again, and welcome back to another lesson on our topic of CREST and how to get it signed off as an international medical graduate. What we're going to talk about now is about your role as a clinical teacher and how you can really make sure that you have that box ticked off and the opportunities that you can find to be a clinical teacher. So if you are in a non-training position, you might often feel that you're overshadowed by your trainee colleagues because, they've got a lot of scheduled training, they've got these teachings, they got all this stuff, and you're just like, well, who do I go to figure out all this stuff? Well, hold up. It's all available to you as well. It's not that there's a hard and fast rule that, for grand rounds only trainees can go, or for departmental teachings it's only for them. Speak to your registrar or consultant within your ward. Ask them if there are already departmental teachings that you can be a part of. Speak to your postgraduate medical center. Ask them if there are any sort of things like journal club that you can participate in. See who runs grand rounds. It varies sometimes from hospital to hospital. Sometimes it is the postgraduate center, or it might be a consultant who specifically, delegates who does what. Find out if there's any opportunity for maybe, for grand rounds, it's going to be your department that speaks. If you could have at least, you don't have to do the entire presentation, but some bit of it that you can be like, hey, here's what I have and this is what I've learned. Okay? Again, I know I said it before, but I'm going to keep saying it, guys. It's about you being ambitious and passionate and proactive. And those are the things that really will help you, be able to get everything signed off. And for the consultant who is going to sign it off to know that you've really tried everything to your best of your ability to make sure that you've done all the things that is required of you. When it comes to a situation, you might be wondering, all right, now they've told you you can do this, you can teach something. Maybe it was some medical students who came onto the ward. Maybe it's some nurses that you're going to teach them something new. Maybe it's your own colleagues in the departmental setting, or maybe it's something bigger than that. There is a methodology to how you should go about teaching, because it's difficult for us sometimes. All of us haven't had that opportunity before where we've taught someone or we've, held a lesson or a class, and a lot of us might be shy about, speaking in front of a lot of people, which is completely understandable. Because it is something to become nervous about. If people are looking at you and expecting you to know certain things and you're just kind of looking back at them and hoping they don't ask that question that you didn't maybe prepare well for. So what I want you guys to just kind of take away from all of this is whatever you do, make sure it's a topic that you do fully understand. It's nothing that has to be super fancy. Don't think that if you talk about, something that's super niche that you'll get extra points in your feedback. Talk about what you're comfortable about, what you comfortably know. Talk about something that is relevant to whatever department you're in. I mean, if you're in pediatrics and then you decide to do your presentation about, gastrointestinal surgery in 85-year-old men, it's not really relevant. You might know that topic fantastically well, but maybe do something like, rubella outbreaks in children or something like that, or vaccinations in today's day and age, or something that is relevant to what you might see in the setting that you're working in. Another thing, when you present, when you're actually there, first try and get an idea of where you'll be doing it. So ask your reg or your consultant or whoever's in charge of wherever you're going to be presenting, what is your environment going to be? Is it going to be a small classroom? Is it going to be a large auditorium? So when you're presenting what kind of, if you have a certain type of information or data that you're going to be providing, that it's something that everyone can hear and see perfectly. All right, so if you're going to be handing out like sheets of paper for people to reference, you'll need to know then how many you need to provide. And you need to make sure that if you are doing that, it's not something that you're going to give to everybody and they're just going to be like this, reading it the entire time and not listening to what you're saying. Because if you see the feedback form that your hospital has or your postgraduate center has, there are going to be certain things that need to be ticked off. And if they're distracted because you've given them something that's taking away their attention, they're not going to be able to adequately just say, yes, you did this, yes, you did this, yes, you did this. So if you got a good PowerPoint presentation up there, there's a couple of tips and advices that I want to give you about how your PowerPoint should be, formatted. Firstly, make it a little exciting. It doesn't have to be in black and white. Put some color in there, maybe, some transitions to make it look a little fancy. Don't get crazy. It doesn't have to have that clickety-clack sound every time the words come up, but at least it should look, appealing, that somebody would want to know what's happening next. Another thing that I want to warn about is what I call the brick paragraph, where you've got like the slides this big and basically all corners are filled up with the words and nobody's really reading it because, I'm sitting in the back and I'm seeing you put some stuff up there, but really I'm not super interested in reading things that are that tiny. All right, I know. There are a lot of things that you know about that topic, but if you put all of it on that slide, nobody's going to read it. What's important in that kind of a situation is to put what's only the really, important bits and pieces on there, and then you can talk about the rest. Like, you put a couple of words up there about, the different types of vaccinations. Just say, oh, there are different types of vaccinations, and then you start talking about the different types of vaccinations rather than just putting up everything you know about vaccinations in that one slide. All right? Another thing you can do to kind of change it up is put up some photos. Like, something that's funny or relevant, some sort of comic that kind of appeals to what you're saying. Naturally, please keep all these things appropriate and professional, but things that can kind of alleviate the situation or the mood or kind of add on to what you're talking about. All right? Especially because after a while of seeing words and words and words in text, people kind of zone out. We've only got so much of an attention span. So if you put something that changes, what we're seeing and how we're perceiving it, it'll keep the person listening. Another point I want to make is when you're talking, and I mean, this is really difficult sometimes because you become extremely self-conscious, maybe you don't realize it. You want to be, like, let's say right here is where I've got my PowerPoint and this is where all the slides are, okay? You don't want to be facing this the entire time. You want to look at your audience, you want to look at your crowd. You don't necessarily have to maintain eye contact like you're looking at them like this and you want them to do everything that you've asked them to do because, come on, man, you're just going to be creeping out everybody in the crowd. But it is important that you at least generally kind of look around and see, yes, you're kind of meeting eyes with the people who are there. If you're super nervous about that, what I like to do is I just kind of look a little bit above everyone. Kind of like, if everyone's heads are here, I'm kind of looking above everyone. So it kind of looks like I'm looking at them without actually meeting their eyes. And then that way I don't get nervous, especially if I lock eyes with somebody and then maybe they laugh and then I laugh and then we're just in a lot of trouble because I'm laughing in the middle of a presentation in front of a bunch of consultants. That may or may not be from a real experience. Anyway, another point that I want to make is if you're doing this, make sure you adequately gesture. I obviously do not have a problem gesturing because apparently I was born to talk with my hands. But sometimes we do get that situation where we're ending up sitting on our hands or we don't know what to do with our hands and they're just kind of awkwardly there and you're wondering, okay, now what am I supposed to do? So what I would like to suggest is if you've got a keyboard that you can use or some sort of clicker to keep this moving, you could at least try and just do the general kind of, politician wave where you're just like, so the important thing about vaccines are they're very good because, blah, blah, blah. Or if you think that that's too much for you to do, at least every once in a while kind of emphasize your point with your hands. Like, if you're like, vaccines are important or something like that. I'm not sure why I'm stuck on vaccines, but I hope you understand the point that I'm trying to make. Besides that, it's very important to pause appropriately. Don't just read out everything or just don't say everything. Like, if you do this thing and then we do that thing and then it happens like this and because we do these things, that's why science is great. You're flat, you're monotone, you're not engaging the person. You want them to be able to hear the lilting bits of your voice, that when you have the proper pause, when you have, the pitch, the change in tone so that they stay interested in what you're saying. Also, a lot of us, when we get really, really nervous, we start swaying side to side. Just try and be stagnant, get your point across. You gotta walk a little bit, make it real tiny or real subtle. So really the takeaway from everything that I've said to you all this far, and I hope it wasn't too much of my rambling, it's about you being able to see your opportunities and then taking up on those opportunities. It's about you being ready to present at any moment and having a topic that you fully understand. It's about being confident when you stand up there, and it's about being sure of yourself as well. Because, we say this a lot, that you need to do these things, but if you're not comfortable doing these things, if you've not ever done these things, it can be really difficult. So think about practicing with someone that you are comfortable, practicing with, or even in front of a mirror, or just basically even just recording yourself and then looking back to see what you can do to improve yourself. Like maybe you're not making good eye contact, or maybe you're stuttering a lot, or maybe you just look visibly nervous. Practicing with yourself over time is really useful because it's not something that'll go away. As a junior doctor, you're doing a lot of presentations and you're doing a lot of, having talks or teachings, but that will continue on when you become a registrar and even when you become a consultant. So the quicker that you get a handle of it, the more practice that you get, the better it'll be for you in the long run. All right, so I hope that made sense to you all, and we'll go on to our next lesson, which is basically we're going to be transitioning from the teachings that you do to the teachings that you can attend.